which is the better technique for removing fat? Is it liposuction? Is it CoolSculpt? Is it tummy tuck? Well, of the multiple modalities that are present for the lower tummy, the abdomen you have to assess the elasticity. We assess the muscles of the tummy, whether you had a baby or not, whether you've had weight gain and loss. That muscle separation on the lower abdomen is a circumstance that may make you, even if you remove the fat, not have a perfectly flat stomach. That's where a woman may want to talk to me about having a tummy tuck. So when I have a patient who says, I want to come in and talk to you about liposuction, I don't want to offend her. I want to teach her that the consequences of lipo are we thin the quilt, I call it thinning the quilt, quote unquote, thin the fat layer. The fat layer, there's a newer technique that's on the market you're seeing on television called CoolSculpt. It's not a perfect modality because it doesn't tighten your skin, but what it can do is potentially shrink your fat layer by what's called fat apoptosis. It suctions a section about this big of fat and it cryoablates it at 10 degrees, minus 10, and then your body, after you massage it a little bit, your body will absorb it. That's a very small area for some people. For some people who are very petite frame, it may just do the trick. One of the problems with it is that it doesn't shrink your skin the way Vaser lipo does. Vaser liposuction is an ultrasound technique. It's a procedure that's done under anesthesia where I infuse fluid into your tissues. It gives you about a 1 or 2 week recovery. It keeps improving for 6 months. It's 100% of patients respond. With CoolSculpt, I don't have that 100% respond, but that's, I think, a patient selection issue that I think there's a lot of places that are not plastic surgeons. They're not technically trained in how to administer or select their patients. So I think the variability we're seeing in our scientific literature and in the patient community is such that if we select patients carefully like we do with tummy tucks and liposuction, it's a really great modality.